Welcome to the American Med Spa Association podcast, Medical Spa Insider. This week, AmSpa founder Alex Thiersch is speaking with Sam Tejada, founder and CEO of Liquivida, and Dr. Christopher Davis, Chief Medical Officer of Liquivida.
What's up, everybody? Alex Thiersch here. This is Medical Spa Insider, the podcast for the American Med Spa Association, AmSpa, and we are very lucky to have on the AmSpa hotline today two people from Liquivida, Dr. Christopher Davis, who is the Chief Medical Officer of Liquivida, as well as on the medical board, the scientific board of the American AIVA Association, AIVA, which we'll hopefully talk about as well. And then very excited to have Sam Tejada, who is the founder and CEO of Liquivida. For those of you who don't know Liquivida, Sam, I'm going to give you a chance to kind of explain what you do so I don't screw it up, but it's been really fun kind of watching you guys take the world by storm when it comes to IV therapy. Not only that, but just the way that you've built out your model, and the way that you've spread not only across the country but across the world. I'm grateful to have both of you. We're going to talk, all things IV, but also, how the IV clinics and how the treatments kind of flow into anti-aging and into aesthetics and to med spas. And I think what you guys have created, you've got some good opportunities for folks who want to add something without maybe who don't have the expertise. So without further ado, Sam, let's start with you. I would love to just give folks a quick Reader's Digest version of your history and how you came up with the concept to start Liquivida.
Yeah, absolutely. Alex, thank you. And I appreciate that great introduction. So, Liquivida, we're a health, wellness, and beauty company where we have wellness centers all throughout the nation. And our focus is taking more of that proactive, preventative approach for people's health, right? And what we do with that is what we call precision medicine, where we utilize a lot of different data points to figure out exactly what's missing out of the person's, overall health, their body, and, lifestyle and everything else. So just to give you a quick overview of how I started the company. So I'm a retired fireman, firefighter paramedic to be exact, here in South Florida. I did 12 years out on the road. And, I saw a lot of stuff working in emergency medicine. Over 12 years working in a specific neighborhood, you start transporting people to the hospital and you start taking those same people over and over to the hospital more frequently. Mm-hmm. You start to see that our traditional medical system is failing them. So that gave me the opportunity to actually start working with a health and wellness company back then, part-time on my days off from the fire department. And, when I started doing that, I started learning a lot of these different approaches to medicine. Long story short, I came across an opportunity for IV nutrition, and I decided, to launch a side gig, on my days off, mm-hmm. with IV nutrition. Started it with $500 in my back pocket. And I had no clue what it was going to turn into. Fast forward to today, it's a multi-million-dollar company. It's nationwide. We're franchising our wellness centers all throughout the U.S. Now we're looking at actually doing certain things internationally as well. We're on the pharmacy side. We created a proprietary product where we've made IV nutrition easy for medical practitioners to implement it in their practice. And most importantly, we're making a lot of people well.
Yeah, I mean, you make it sound so easy. All you got to do is quit your job, start something up with $500, and you're there, right? That's how you do it. I mean, my goodness,
overnight success, baby.
I'm sure. I know how hard it is, and there's a lot more to that. And I would want to get into that. Before we do, Dr. Davis, I'd love to get your perspective. And how did a former firefighter get you roped into this business, and all of a sudden here you are?
Wow, that's a good question. So I am. This is interesting. Actually, this is a great story to tell as well. As we kind of have grown over time, it's interesting to think back, 7 years ago or so. I actually am an interventional cardiologist by training, and so I practiced interventional cardiology for 10, 12 years, and very similar to Sam. I saw a lot of problems with our current medical system. There were that open door around, open the door and then let them out and they come right back in type of medicine that we practice. And so I think that a lot of people these days are understanding that we have some pitfalls in our medical system, and something has to change. And for me, I was frustrated because I knew there was more we could deliver as physicians. And we spent a lot of time training, but there was more that we could deliver, but not exactly knowing how I would do that. So I had my own cardiology practice down here on the Gulf Coast in Sarasota, Florida. And I didn't know, I wanted to be a wellness center, but I didn't know what that looked like. I didn't know how to bring that in. And I don't recall how exactly the IV nutrition therapy crossed my radar, but I think it was one of my functional nutritionists said, what about IV therapy? I know this company called Liquivida, and they introduced me to Liquivida, and I kind of had read a little bit about it and reached out to them, got a little more information. And then my wife and I decided to make a trip down to South Florida and meet with Sam and his wife, Shana. And this was still kind of early on, thinking about it now, right, Sam? This was they had been, I guess they had been, 3-4 years in business at that point, something like that.
Pretty much, yeah.
And I went down to South Florida, and really, I was impressed by what they were doing. Even then, it was more so just hearing Sam's story, like you just heard. I mean, a firefighter who decided he was just going to start this company, and I really saw the drive and motivation that he had. And that went a long way. I mean, he had fire in his eyes about making this whole business work. And so for me, I was like, okay, well, maybe this IV therapy is something I can bring into my cardiology practice as a wellness, my introduction into the wellness. And so that's what happened. We decided to do exactly, and we had this integrated model where I just brought in IV nutrient therapy into my cardiology practice as an add-in cash pay service. So some of it was a business. It was me to figure out how I can have a cash pay business to try to move myself away from the old insurance model, right? And so that's what we did. And, again, just to fast forward, I started not knowing anything about IV therapy. I was like, what am I doing? I don't know anything about IVs, but, I learned a lot from the staff there. I took a lot of time on my own to learn more. And over time, it really blossomed. And Liquivida has blossomed so much more than just IV nutrient therapy right now. And that's the exciting part. Where we're going with this company is much greater. The IV therapy is a pivotal part, but where we're going as a company has just continued to grow and grow and grow. And so we really want to change the way medicine is practiced. And so being with Liquivida has just allowed me to do that. And I'm just excited about what we have to come. Sam and I, have become great friends and business partners. And as we grow this thing, there are lots of things on the table right now. We're seeing some doors open that we really can change medicine. Initially, when I stepped out of this whole, allopathic medicine, what am I going to do? But there is a road right now that is clearly in front of us for how we can make a big difference. So super excited.
That's awesome. I anyone who knows me, I love talking to people who have a similar story like that, who have, taken something that was an idea and then built it into a reality, because it's not easy. It takes a long time, takes a lot of hard work, and it's cool to see what you guys have done. One thing I'm curious about, and Dr. Davis, I want to ask you one quick follow-up is, tell me about, a lot of what works and what gets people excited from the aesthetic side who have med spas about adding IV or vice versa is the impact that IV therapy has on people and the way that they feel kind of from the inside out. With your practice, you're dealing with cardiology and you add this service in. Can you talk about what the impact it had on your patients? Because I imagine that's one of the things that spurred you to want to do more, is that you kind of see what this can do for folks. And in your position, it's got to be unique to be able to see the actual impact it has on patients.
Oh, absolutely. Absolutely. I think that, and there's so many different impacts. I think that first and foremost, it's just overall feeling better, having more energy, having more drive, right? Most of us are micronutrient deficient, right? Most of the American population, given the standard American diet, SAD diet, so to speak, are micronutrient deficient. And at the last AmSpa conference that I spoke at, basically I did a lectures was on micronutrient deficiencies. And so, if you, and I truly believe one of the major add-ins for a med spa practitioner as well is to do micronutrient testing, because what you'll see is that your therapies work a lot better when a patient or when a client is balanced with respect to their micronutrients. And so what I started to see, it wasn't just about giving the nutrients. I saw the numbers that were abnormal when you do the micronutrient panels. And then as we give them the higher doses of IV nutrient therapy, B vitamins, some of the antioxidants like glutathione and vitamin C, you see these numbers improve. So not only do you see the numbers improve, when the numbers improve and the clients feel better, right? These things go hand in hand. And so you can show them the why. At the end of the day, functional medicine is looking at root cause. Why do we get older? Well, there are lots of what we call the hallmarks of aging, but one that we can really spend some time talking about is, mitochondrial dysfunction and mitochondrial function in general. And so the mitochondria can't function normally when you are micronutrient deficient, period, full stop, right? And so if you can measure those micronutrients and then selectively oral and IV nutrition therapy, give that back to them, they're going to feel a lot better. One of the things about IVs I think is super important is that when you have poor gut function and leaky gut, we can take all the oral supplementation in the world, but it's not absorbed well, right? So part of getting nutrients into a system is absorbing it from the gut. But on top of that, the next part is getting those nutrients intracellularly. It has to get into the cell. Well, when we're full of toxins and our cell membranes don't function normally, guess what? The nutrients, even if I absorb them, don't get intracellular because of the toxins that are on the cell membrane. So I don't want to get too much in the science of it, but it has opened my eyes and taken us to a whole different level of what we're looking at when we evaluate our clients. So we're looking at truly the underlying root of a lot of these issues. And so there's a very unique space, I think, for the aesthetic component, because the same thing that makes us all inside makes us all outside, right? So if you look at that root, we don't have to, doing the procedures on the skin, and if we're doing lasers and things like that, that's going to help. But guess what? It's going to help that much more when the patient, I call it, when you have the materials to build a house, you're going to respond a lot better, right?
That's right. Yeah, no, you mentioned mitochondria. I got mitochondria tattooed to my chest right now. It's amazing. I got it written backwards so I can see it in the mirror, though. It's awesome.
Yeah.
It's all mitochondria nowadays. It's everyone knows that. But hey, Sam, the reason I don't want to make a joke, but I'm kind of making a point there, Sam. And what it is it's one thing to have this medical knowledge and discuss the science of it, right? And it's quite another to take that science and even the technology that exists to deliver the science and build it into an actual business, right? That's two very, very different things. And what you've done that I think is fascinating is when a lot of folks in aesthetics especially started learning about IVs, they're like, yeah, it's great because you can get them to come into your office and they can sit there for an hour and you can sell them stuff. That was kind of the whole purpose of it. But to make it in and of itself a business and a scalable business and a franchise model like you've done, given the things that Dr. Davis was talking about is impressive. And so it's one thing for you to say, I got this idea. How did that go about saying, you know what, I'm going to actually take this $500 and I'm going to make an actual business out of it? And how long did it take? I'm curious what that story and what that journey was.
When you go back about 12 years ago and you tell someone, hey, come sit down in this comfy chair and let me put a needle in your arm and give you some vitamins, that's not the easiest thing to actually convince someone to do, right? People freak out. So there was a lot of educational marketing that had to go into place. There had to be a lot of reputable, influential people to be able to speak on what we're doing. Early on, people looked at this and they said, oh, this IV stuff is a fad. And the reason why people were saying that it's a fad, something that's coming in and leaving very quickly, is because a lot of the different companies that were out there were doing it for the hangover cures. Right. Now, does it work for hangover cures? Absolutely. Because at the end of the day, when you're hungover, you're dehydrated, you have an electrolyte imbalance, and we're going to deliver all of that stuff directly into the veins, and you're going to feel fantastic within 30 minutes to an hour. But that's not what we're doing with Liquivida. So what we're doing is we're actually providing a true clinical treatment for patients who have deficiencies, that this is actually providing great outcomes and true benefits. So when we're doing this, how I said earlier, through different data points where we can actually show the different deficiencies that people are having that are related to the symptoms that they're seeing every single day, the signs and symptoms. And then we can actually start treating them with these IV nutrition and then showing them that they're not just feeling better, but also the numbers are getting better. That there is science, right? So what we're doing here is actually showing people that this works. This is not some kind of hocus pocus snake oil fad or anything like this. Like, we will show you that it works. We will show you that there's deficiencies. We will show you throughout the trending process, repeating the blood work, that it's working and it's going inside of your cells. So ultimately, what we're doing is we're giving people the definitive treatment that they've not been able to get for many years.
Yeah, that's very well said. So, if you don't mind, let's talk about kind of the business aspect of it. Now, most of the folks who are listening to this come from the aesthetic world, right? So we're either working in med spas, looking to become providers in med spas, plastic surgeons wanting to open, and you've, I think, done something, and in many ways, obviously you've been involved in the American AIVA Association, which I think is a great organization. Everyone should check it out. One of the things that I found impressive when I was talking to you all about that was just how big and how wide ranging the IV market has become, and just how successful it was as a business strategy. When you talk to folks who are in aesthetics only, and start talking about IVs and what you guys do, what are some of the things that folks need to be convinced of, and what's kind of the value prop that you provide from an IV, from adding that service to a med spa or an aesthetics practice, or, I know you have another version where you kind of start everything from scratch. What's that like, and what questions are people asking you, and what are some of the hangups they have to get over?
Well, I would say most medical providers that are trying to get involved in IV nutrition, they're trying to figure it out. They're trying to figure out what is it and what can we treat with it. And even a lot of the providers that are offering it, which you go into some of these med spas, and this is something that I don't agree with. You go into some of these med spas, and it looks like you're walking into like a smoothie shop, and you're picking off a menu. So that's not the IV nutrition that we recommend. We recommend doing IV nutrition with your patients based off of those different data points, doing blood work, body composition analysis, doing the VO2 max, the RMR, and really understanding how your patients their health is overall performing. So for us, is being able to educate these providers and truly let them know what the real benefit is by offering IV nutrition. It's not just a moneymaker, right? Well, obviously, when you're doing something right for your clients, the money will come. So ultimately, the questions are, what can I really treat my patients with IV nutrition? How can I actually figure out what to treat them with, what their deficiencies are? And that's where Dr. Davis was just talking about doing the blood work, right? So in my opinion, those would be some of the most questions that we're getting. And then from there is, when they are interested in offering the IV nutrition, how do they do it? How do they dose it? How do they do it in a way that it's clinically safe for the patient to receive these IVs? Because even though we're talking about nutrients, right, vitamins, minerals, and amino acids, you give a patient too much zinc accidentally, that can cause irreversible hearing loss. So even though these are water-soluble vitamins, you still have to be careful. You have to be extremely careful. There's other things you have to watch out for. The osmolarity of the bag. Is it a hypertonic solution or a hypotonic solution? You're dealing with people's lives here. This is a medical treatment. This is not just something that you can just play the guessing game on. And that's why there's companies like Liquivida and also the American AIVA Association to provide, that type of support.
Yeah, that's a great segue. And Dr. Davis, so AmSpa, as you know, and if you've been to one of our events, so you're familiar with what we do. But I'm a recovering lawyer, as I call myself, and we are, our mission is to provide the aesthetic industry with resources so they can grow safely, successfully, and be profitable, as well as being compliant, right? And one of the things that we've seen with our industry, and we're seeing this also with IV, I think, to an extent, is with fast growth, you have people who are coming in and they just want a piece of it. They're not necessarily treating it with the respect or the seriousness that it deserves. And as a consequence, you can have accidents, right? You can have things like Sam was saying with, adding the wrong thing to a bag, an IV bag. And I think one of the things that people don't necessarily realize is that there can be serious consequences. We saw this in Texas not too long ago, some lady, and it was in a med spa, and I think that had to do with, although we don't know for certain, what, like, not knowing what was going into the patient and not having that frame of reference as a physician and as a board certified cardiologist. Do you say you're a cardiologic surgeon as well? Is that what I saw?
Interventional cardiologist.
Interventional cardiologist.
Yep.
What, like, thinking about the medicine and treating folks, did you have any reluctance when you came in regarding kind of the safety of this and where this might go, getting some of these things to pop up in strip malls, and the follow-up to that is, how do we go about ensuring that we are doing this safely? People can be successful, they can make money, but the most important thing is treating the patients well and being safe about it.
Right. I mean, that's a fantastic question. And actually, that's probably the most important topic to deal with when we talk about IV nutrient therapy and how the business of IV nutrient therapy expands, and it needs to expand in a way that's safe. I mean, there's no question about the fact that that's where the American IV Association has come into play here. One of the main reasons for this organization is to bring a group of us together to help to design some guidelines on some of these factors. Now, we're not going to all have the same protocols, right? But there are some very basic safety factors that we must adhere to. And so absolutely, IV nutrient therapy and doing any type of IVs has its own set of inherent dangers, right? At the end of the day, when it's done appropriately, IV nutrient therapy is very, very safe. When I first got started, again, I was scared because I didn't know much about IVs. And so really finding an organization or some other group that's going to help to give you protocols and education on what to do and not to do. What I would say is it's very important to start slowly, because even with Liquivida right now, we have some very basic IV drips. There are a lot of things that you can give IV, a lot, right? But we don't do many of those things because there are some nuances of doing things like IV curcumin, IV alpha lipoic acid, and they are very helpful as well. But there are some other risks that come and other contraindications to utilizing some of these things. So you have to, and I think what ends up happening, because the business is growing, there are lots of people that just want to jump in, and that's the problem. That cowboy mentality, just to kind of jump in and start doing this, is what we're trying to avoid. And honestly, what we're trying to do with respect to AIVA is we're trying to kind of get in front of this before the FDA and something happens that they actually start to make all these all these rules and regulations that start to govern us that really are not fair to the industry. And so certainly the right organization to help teach any other med spa practitioners that are interested in implementing IV nutrient therapy, that's the primary reason that AIVA was formulated.
Well, and Sam, you have an interesting position, because you're and honestly, both of you do. Not only are you part of AIVA, the IV Association, but as the business owner growing Liquivida, you've got to be sure that the folks that are buying from you are up to speed on how to do it. And I'm curious, like, how do we make this how do we grow this industry, this side of the industry, in a safe and responsible manner, when you've got so many folks out there who see, they think it's, hey, we're going to get rich quick, this is going to be a good thing, I'm going to do this, I'm going to provide hangovers, all my buddies will come in, we're never going to be hungover again, all that kind of stuff. When the reality is much different, how do you balance being growing a successful business, and how do we make this industry safe?
So it comes down to education. So the same way we're here on this podcast, and Liquivida and American IV Association is teaming up with the AmSpa, this is what we need to do. We have to, as an industry, collectively come together and make sure we're providing the right educational information so people are doing it safely. Because at the end of the day, all it takes is one event. You mentioned it a few times about the event that happened in Texas. And I spoke publicly about that. I got interviewed by multiple different news outlets on it. And it's an unfortunate event. And if that person was properly trained from the start, we wouldn't be dealing with that issue that occurred. So ultimately, it comes down to being able to provide these medical providers with the resources they need to be able to practice medicine properly when it comes to IV nutrition. So my goal here is not to just do it through the American IV Association or Liquivida. It's really getting on certain platforms like the AmSpa and other platforms that are out there, and be there to give these people that type of support. Ultimately, I'd like to see people like Dr. Davis, who's on the scientific advisory board, to actually conduct some of these accredited courses when it comes to IV nutrition. And then ultimately, having these type of courses where people can get a certificate of completion that they participated in it, that's where now we utilize our different platforms to educate the public to look for an IV therapy center or a med spa that has been certified through some of these accredited courses through the AmSpa.
And Dr. Davis, what Sam just said is interesting. How do you as a physician, educated, board certified physician, mentioned you had to learn and you had to, you had some nervousness when you started. Where do folks go? And I know we've got the IV Association, but like, where did you learn how to do this? How do folks get to those resources? And I think Liquivita's done a great job of providing that also. But like, what's the answer to that?
So that's another very good question, and I will say that wasn't easy. As we look at it, particularly being an allopathic board certified physician, we're always looking for the data, so to speak, right? Where is the data on IV nutrient therapy and that it works? And unfortunately, published randomized trials looking at IV nutrient therapy, that part is, there's some data there, but it is hard to come by as far as lots and lots of trials, because these are not trials that people have done. IV nutrient therapy has not been looked at in that way. And that's one of the other things that we're trying to do as an organization as well, is to start to put we know anecdotally and clinically through our clients that they feel better, they get better. And I'm not talking about just feeling like I have more energy. I'm talking about dealing with issues like Alzheimer's disease and mold and Lyme toxicities. Utilizing these strategies of antioxidants like glutathione and other phospholipids like phosphatidylcholine, we know that they work hands down. People get better, okay? But there have not been these randomized, double-blinded randomized controlled trials that show that. And so where did I get the information? Really, there's a couple of IV nutrient therapy textbooks out there. I purchased those, read those. For me, there's one particular guy, Dr. Paul Anderson, who is just one of the world's experts in IV nutrient therapy. I follow all of his work. He has online courses. I've been a member of his whole course and at his university for 3 years now. And it really took a lot of self-motivation to go find the information. And what we're hoping to do now, though, is to start to pull that information and start to create on our own data set. So amongst all of the major IV nutrient therapy companies, there we have a lot of clients in between all of these organizations. And so we are now starting to design, even if they are retrospective looking back, we're looking at designing trials to look at the safety of IV nutrient therapy and looking at some of these clinical outcomes. So, to answer your question, the short answer is it's tough to find a lot of that out there, but I can certainly provide, and any of the AmSpa people who are looking for it, I could certainly provide links to some of the references that I use to get this information. But we're really trying to put all of this data together now so that we create a IV nutrient education protocol portal so that we can educate individuals. So, so that's a good question, because I think we need to really create something that's easy to go to. Like Liquivida has itself our own education portal, but I think that if we can get all of these major, like Revive and Drip Bar, we get all of these major players in the IV space together, and we're trying to combine kind of what we're doing and utilize the data from all of the clients amongst those organizations.
No, it's just as easy as buying a textbook and reading it. That's what everyone does.
Yep.
The old weekend textbook reading a marathon. That's helpful. So what I want to talk about real quick is I'm interested in Liquivida, and we're gonna have you guys back, and we'll have to have the folks from AIVA on as well, so we can dig into that, because I think what you guys are doing is helpful. It aligns a lot in what AmSpa is doing as well. When it comes to Liquivida's offerings, if I'm a med spa and I want to add IV services, but I'm not confident how to do that, you mentioned you have a product for that, but then you also have kind of a greenfield building from the ground up center product where you can kind of add everything, including med spa services. Sam, talk about the different options that folks have to work with you guys, and how they go about making the decision what's the best one for them.
Yeah, so, Liquivida is really well known for IV nutrition, but when you look at a Liquivida Wellness Center, there's a lot more to it, because IV nutrition is not going to just be the only thing that fixes the problem or make people perform better or fix whatever the root cause is when it comes to their health or wellness.
Mm-hmm.
So Liquivida, we focus on what we call the Vita journey. So the Vita journey has 5 different pillars to it, which is the wellness, the medical aesthetics, medical weight loss, regenerative medicine, and then also sexual health. So we have a magnitude of different services and modalities that we offer in each pillar. When it comes to the wellness side, we're doing everything from hormone optimization. We're doing all of the comprehensive blood work, including specialty blood work, where we're looking for toxins, which Dr. Davis is an expert at environmental toxins. And then, we're looking at the weight loss. Weight loss is its own pillar, because there's a lot of things that go involved in the weight loss process. It's not just one magic pill or one of these GLP-1 injections. The weight loss process includes nutrition. It includes exercise. It includes also lifestyle, the way how you're sleeping and recovering. These are all of the different things that we work on when it comes to Liquivida as a Liquivida Wellness Center. So, those are things that we try to teach throughout the process. Even when we talk about IV nutrition, we teach people how IV nutrition works in conjunction with all of these other services and modalities as well.
So the Liquivida Wellness Center, if someone is interested in doing that, it's literally a kind of its own freestanding center that provides all those different services, those 5 different pillars you were talking about. And there is an opportunity for folks to be able to engage in and open up one of their own. Is that fair?
It is. Yes. We do have a franchise model where we put these beautiful wellness centers all throughout the United States. And one of the things that we do also are, med spas that open up and they're struggling a bit to figure out how to penetrate their market or figure out a lot of these different services and modalities. And instead of trying to figure it out on their own, we've gone the route where we've converted existing med spas into Liquividas as well.
Okay. And they can, though, if I just wanted to add a certain service, you guys have the ability to add like the Liquivida IV. You had a name for it, and I'm sorry, I can't remember.
The Liquivida Integrated Lounge. Or
Integrated Lounge. There we go. Yeah.
If you have an existing med spa or wellness center that doesn't offer IV nutrition, what we could do is we could actually put a Liquivida Lounge with the lab where we mix the IVs into your practice. The best way I could put it is the same way that you go to a brick and mortar Starbucks facility. You could go to the airport, go to a nice little Starbucks kiosk, and you're still going to get the great quality coffee plus the brand and the experience behind it.
Yeah, that's awesome. That's exciting. And what's your tell me about kind of your growth right now? How many locations do you have? Where are these wellness centers located, and what's next? Are you guys focused on world domination or intergalactic?
Yeah, so we definitely are focused on growth, but not too fast, because this is not the easiest business to duplicate. It's not a taco shop or a frozen yogurt shop where you hire high school kids or college kids to run it. The one thing I tell people, the business that we're in, we provide careers, not jobs. The people that actually work at our facilities, they went to school, some kind of formal education to do what they do, regardless if it's a technical school, vocational school, or graduate school. These are people that are doing this because they're passionate about it, and this is what they decided to do as a career. So Right now, we've sold 37 locations. More than half are open in different parts of the nation. We
That's
have
awesome.
locations in Arizona, in Texas. We have locations in New Jersey, Connecticut. We just sold a location in Georgia, in Atlanta, in that area. We have a location that we're finalizing in Chicago. We have several in Florida. So our goal is to really strategically place them all throughout the nation.
Hey folks, it's Alex Thiersch. When it comes to injecting in the face, safety is more than skin deep. One wrong move could cause serious injury, hurt your reputation, and possibly endanger your business. That is why AmSpa partnered with the Academy for Injection Anatomy to create the AIA Advanced Cadaver Course, the most thorough and advanced facial anatomy course in the industry. Created and taught by renowned board-certified plastic surgeon Dr. Chris Zurich, one of the foremost facial anatomists in the world, along with his hand-chosen faculty of the most experienced injectors in the industry. Students experience firsthand and close-up the anatomy of the face so that they can inject safely and confidently. Unlike other cadaver courses with large groups or limited access, the AIA Advanced Cadaver Course provides small group instruction with a high faculty-to-student ratio and a limit of 4 students per cadaver specimen. Everyone who attends gets a chance to inject real product and then dissect cross-sectionally to see how close they came to vessels and other important structures of the face. This hands-on cadaver lab follows a full day of instruction on facial anatomy from our world-renowned faculty, including discussions of complication management, rheology, and an introduction to the use of ultrasound in your practice by Dr. Steve Weiner, one of the pioneers of using ultrasound with facial injections. At this 2-day course, students learn how to avoid common danger zones, how dermal fillers behave, and the best places to place product for safe, outstanding results. More than 3,000 aesthetic injectors have improved the safety and efficacy of their injection techniques with the AIA Advanced Cadaver Course. Now it's your turn. Visit americanmedspa.org/AIA Advanced. Start your journey to safer injecting today. That's awesome. I love how you reference it as, you want folks to have a career in this, because I think that's important. It can't just be a flash in the pan. It can't be a fad, right? You can't say, I'm going to go in this and just do this for a bit. Speaking of which, Dr. Davis, I mean, speaking of careers, you've now become the chief medical officer. What are you doing with your time? Are you fully engaged with this, or do you still have your own practice? What's your day look like?
I'm not even sure how to answer that question.
That tells you all you need to know, I guess.
So my day is quite full. What I've tried to do, my goal when I stepped away from allopathic medicine was to change the way medicine is practiced, whatever platform it took for me to do that. Liquivida has certainly been that first stepping stone that has allowed me to continue to branch out with all that I'm doing. Like, one of the things that having to figure this out has done is it has allowed me to learn constantly for the last 8 years. So like beyond what traditional medical school and fellowship and residency has taught me. And what I say right now, and this is what Liquivida is, what I try to do is, I still have my own medical practice as well. I have a longevity center in Sarasota, Florida. What I try to do, though, what we're doing, though, is everything that I work on is all the same within whatever entity that it is. So the things that we do in Liquivida are the same things that I am doing in my medical practice here in Sarasota. Mm-hmm. And my new branding that we just really launched is that science is 25 to 30 years ahead of current medical practice, okay? And it always will be. And so for those of us as medical practitioners who are really avid learners and really trying to change medicine and trying to help our clients change people's lives, right? We cannot be stuck in the medicine of yesteryear, is what I say. Mm-hmm. And I can tell you the things that we're doing with like hyperbaric chamber and photobiomodulation and ozone. One of the things we're rolling out with Liquivida right now is ozone therapy. And so we are always keeping up with the times, but not waiting for all of our medical governing boards to say, okay, this works, because mm-hmm. there's enough information out there right now that we know that it works. So if I'm going to use ozone therapy or hyperbaric oxygen for my client, and I know that people with Parkinson's disease are going to get better if I use hyperbarics or whatever ozone therapy, then why am I not using that now, right? So what I do with my time is honestly, so yeah, we have a longevity center. These are the same concepts that we use. We're rolling out a metabolic health component of Liquivida. This is really front and center for us right now. Is it goes right along with the whole IV nutrient therapy role, because we use IV nutrient therapy to improve overall metabolic parameters, right? So we're assessing this with VO2 max, looking at oxygen and carbon dioxide exchange to assess mitochondrial function that's on your chest, right? So we're super excited about that, right? It's taken a lot of, it does take, what Sam said is so true. We're not trying to move too fast on this, because we're not just an IV nutrient therapy company. We're trying to change the way medicine is practiced. And we have some strategic partnerships that are in play right now that will help us change medicine if we keep moving in the direction we're moving.
That's awesome. It's all about mitochondrial function. I'm telling you, that's the word of the day. Sam, how did you get, so like I said, I'm a lawyer, English major. You were a paramedic, firefighter. Somehow in the way you speak, I love the way that you're laying out, here's the pillars that we have, here's what we're trying to build. I mean, all those things are, you go to any business seminar, they're telling you to follow, to make sure that you got guideposts, you've got a plan, you've got these things in place, you've got a mission and a vision. You guys are speaking the same language, which I think is incredible. How did you get the knowledge to be able to scale a business, like to start and scale a business like this? Because I don't think they teach you that in firefighter school.
No, they don't. Unfortunately, they don't. So I've always had that entrepreneurial spirit since I was a kid. But ultimately, I'd be lying to you if I told you that I did this by myself. Ultimately, when I launched the business and really saw the opportunity and the potential, that's why I had to say, how am I going to do it? How am I going to do it on a fireman's salary, which is not much? So what I ended up doing after a year of starting the business, I ended up pitching my idea to 5 different partners that became partners of Liquivida. And my goal there was, to do this starting with $500 in my back pocket, I have to create what's called the minimum viable product. So having that minimum viable product and be able to actually take the dollars that are coming in and put it into growing the business and bringing people in through the door, that's where I had to put a lot of different strategies into place and see if they work. So when I pitched this to the 5 partners initially, it was the chief medical officer, which back then was Dr. Robert Willix, who was one of my business mentors. He was the chief medical officer of Cenegenics, which I worked part-time before Liquivida with Cenegenics and learned a lot of this functional medicine education came from there. Unfortunately, Dr. Willix passed away right before COVID. And that's where Dr. Davis, being one of our franchise locations, the opportunity was there, and he came on board as a partner and took over the chief medical officer role at that point. And I pitched it to the other partners, the CFO of the company, the attorneys, the chief marketing officer, and then myself, that was more operations. So at that point, we had 5 top minds that were behind the company, putting in a lot of sweat equity to get the company where it's at today.
Mm-hmm. Yeah, no, I mean, again, you make it sound so easy. You go to 5 people, you pitch them, boom, you got 5 investors that are behind you. That's no small accomplishment. I have to say, anyone who's ever pitched anything to investors knows it's nerve-wracking. It doesn't always go well. There's always folks who tell you no. So that's an inspiring story. Was there a moment that you can look back on as an entrepreneur? And I guess I asked this to both of you, really, where you kind of had that inflection point where you're like, you know what, this might work. This is going to be the thing that I'm going to hang my head on. And because that, to me, as an entrepreneur myself, like that's when everyone thinks being an entrepreneur is so much fun. You get to wake up in your pajamas, whatever, it's great. But really, it's so difficult. And there's always that point where you start to realize that this could actually work. And then it becomes a passion and it really becomes fun. And that's always a bright spot in kind of your journey. Do you remember when that happened, Sam? And then I'd love the same question for you, Dr. Davis.
Yeah, I felt like I was about 3 months in when I started feeling that, when I first started the business. And then that's why I started kind of really thinking like, how am I going to do this? And once I was like about a year in, that's where I said, okay, what I have to do is I got to, number one, get people to believe in what I'm doing. And then number two, which is to me is the most important part, is whoever I pitch this to, they have to believe in me, right? So I have to be able to persuade them and be very influential about what I'm doing so they believe in me. And then from there, they come on board and we just take off and make it happen.
Yeah. And you have to be, they have to believe in you and believe in your sincerity too, right? You can't be a snake oil salesman. Same question for you, Dr. Davis. It's a little bit, you're coming from a different perspective too, because as a physician, you've got, other physicians in interventional cardiology going, what the hell are you doing, man?
Yeah. So definitely mine was a little bit of a different experience. And definitely it didn't take me 3 months to realize. What I'd say is, it took years for me to realize, I literally just shut my doors, walked away from well into the 6 figures. 7 figures, well into the 7 figures. Walked away from it all and said, I got to find a way to do this a better way. It meant recreating myself. It meant walking away from a thriving cardiovascular practice and recreating who Dr. Davis was. It was incredibly scary because I was walking into a world that I didn't know a lot about. IV nutrient therapy, functional medicine. I knew that that's how we can get people better, but I didn't know the world. Unfortunately, if I had done this right, I probably would have kind of done this in a way that was a little bit slower, but I'm the kind of person, once I see there's a problem and I got to fix this, I don't like to keep doing the wrong way. I don't like to keep doing it the wrong way. So I just said, I'm done with this insurance stuff, and literally just closed my practice and said, okay, if people want to come see me, I'm going to do a concierge service. They can pay me to come see me. Well, that wasn't as easy. I did maintain some clients, but it wasn't as easy as, people that I got insurance. Why am I going to pay anything? Right. So that transition for me took a few years because I had to figure out how to make it work. What is the value that I'm bringing? What is the value proposition here that I'm bringing, and how do I make this business work? And so really, I think what happened with me, and I can't tell you exactly when the inflection, I had to become more comfortable with myself that I had value that nobody else that could provide. And it took me a couple years to just learn. Like I told you how I started to learn IV therapy. It took me a few years just to kind of learn. And once I kind of got to a point where I realized that I know more than most doctors out there on how to get these people better. And that's not me being arrogant, right? It's just I knew a different way, right? And once I got comfortable with that, then I knew that there was a road ahead of me. And now, honestly, at this point, we're not even sure we're not even sure where the road goes anymore right now. I mean, there's a lot of opportunity in front of us to really make big things happen. But it definitely took me there are many days that I thought about just going back to the hospital so I can make a lot of money. I mean, the no question, up until about 3 years ago. Yeah, many days I thought about just going back into the hospital. Okay. But we're at a point now where that's all in the past because, it's so much joy to practice medicine the way we practice medicine now. I mean, I can't even tell you, like my last first few patients this morning, and you see somebody who has rip-roaring diabetes 5 months ago, and now his diabetes is gone because you just gave him a roadmap, right? You gave him a roadmap on how to get better. I mean, it's just incredibly fulfilling to be able to do that type of thing. So it took me a few years.
No, it's awesome. It's, everyone's got a different path, but I feel like at some point, and a lot of folks listening to this are contemplating, they want to open their own business. They want to be an entrepreneur. It's a scary prospect. Not everybody has the gumption, Sam, that you do. And same thing with you, Dr. Davis, where you're just like, I'm going to close my practice. This is it. Like that. It's, it takes guts to do that. We've been, yapping at each other here for 45 minutes, and I'm curious, as we wrap up, what I like to ask this question to kind of everybody for both of you. What are you most excited about with this industry, which I think you've already touched on quite a bit, but I'm curious if you could name one thing that you're really excited about. And then is there anything, Sam, that that makes you nervous and that kind of scares you about, what could be that, what keeps you up at night about the industry or about your business?
So I'll start off with that question of what scares me, which is not much, but at the end of the day, when it comes down to a lot of the services and modalities that we offer, they're starting to get regulated by a lot of these governing boards and agencies. And the people that are putting the regulations on us are people that have no clue of what we're doing. So it's a little bit scary that those decisions are being made. This is why we put so much emphasis of us coming together as an industry and creating that one strong voice so we can truly educate these regulators on what we're doing and bringing the science behind us to show it. But what really makes this such an enjoyable process is that we're part of this bigger movement of changing the course of medicine. And right now there's a big movement that's happening, and you've probably seen it, where it's talk about making America healthy again, right? This is something that needs to be done. There's so much stuff that is causing people to live such an unhealthy life, and people have to know about it. And a lot of the reasons why people don't know about it is that they don't have that resource to let them know what they should be eating, how they should be functioning, how they should exercise, what they should stay away from. So knowing that I can be part of that and make a change in many lives. Listen, this is why at a young age I became a lifeguard. I worked for ocean rescue. This is why I became a firefighter paramedic. I'm here to serve. I'm here to make other people well. That's what makes me feel good, right? The reason why I volunteer my time to be the chairman of the association and contribute on a monthly basis to the association, I don't get paid to be part of it. To be honest with you, I don't even have the time to actually even do what I'm doing with the association. I just make it happen because I know at the end of the day, it's going to benefit a lot of different people. And that's what's rewarding to me.
That's inspiring. And it's, it's very similar to what AmSpa is doing. I think I applaud you both. Dr. Davis, kind of same question for you. What are you excited about, and what are you nervous about moving forward?
I'll start with what I'm nervous about. I think we are opening a lot of doors. There's a lot of stuff for us to do. How we strategically use our time to make the difference that we can make. I think when you put when your priorities are in the right place, like Sam said earlier, everything else seems to work out. And I think that Liquivida is at a point right now where there's a lot of opportunity on the table. And sometimes it's overwhelming. Not sometimes, a lot of times it's overwhelming. Between Liquivida, my practice, there's a lot of overwhelmingness that's happening right now because, you understand, and people want you to help them, or partner with them to kind of make a difference in this space. But it can be overwhelming in trying to figure out how to make those moves strategically. What I'm excited about goes along those same lines. For the very first time, I won't put any names out there, but we have right now a possibility. We're working with a hospital corporation, which is a traditional healthcare hospital corporation, and starting to basically intertwine some of the more integrative and functional medicine approach to what we do with IV nutrient therapy, what we do with a lot of our other integrative therapies, into a true hospital corporation here in the United States, which that's unheard of, right? And so when we talk about changing the course of medicine, collecting the data, creating the research opportunities that need to be there that show that IV nutrient therapy works, that's super. And in a million years, I didn't think that would happen at this point where we are, but it is very much on the table and essentially there. We just got to now, and once that happens then we start to change medicine, because now you're partnered with an organization who are doing IRBs and real trials of these techniques and the therapies that we're doing. And so now all of a sudden, the people that are, talking about this being some, fad or quackery, if you will, right? Now all of a sudden, we have the data here. We have the information. So that's what's most exciting to me. I mean, we have the ears that are going to start listening once that happens.
Yeah. Yeah. No, it's exciting hearing you guys talk because you're absolutely right. There's the moment when your business becomes a business, and then there's that kind of subsequent moment when your business becomes successful and doors start opening, and that is both exciting and terrifying at the same time, right? Because you want to make sure you're doing the right thing. And Sam, you're helping other people both when it comes to patients, but also business owners, right? So you're guiding them on their journey. I think it's cool to see what you guys have done. Sam, I'll give you the last word, and if you don't mind, like, where can folks find out more about what you're doing? Where can they reach out to you? You've both been at MedSpa show. You've been part of AmSpa, so you can find you guys through that. But I'm curious where you want folks to go to get more information.
Yeah, they can go on our website, liquivida.com. We're very active on social media, both myself and Dr. Davis. So you can find us on Instagram. We try to share as much information as possible. I have my own podcast, A Healthy Point of View, which will be recording another episode with Dr. Davis very soon. And then, Alex, would love to have you there to talk about a few other things. So, but yeah, people can find us on, listen, if they have trouble finding us, just Google us, Sam Tejada, and you'll see everything that pops up.
It's not going to be tough. I appreciate your time. I know you're both super busy. Check out Liquivida, check out the American IV Association, AIVA. They got a lot of great resources as well. We're working with them on a bunch of stuff. And then, I appreciate it, guys. Appreciate your time.
Yep. Awesome. Thank you.
Thanks.
Alex,
Thanks so much.
appreciate it.
Appreciate it.
Thank you for watching the Medical Spa Insider podcast. Please make sure to subscribe to our channel for future videos and podcasts. For more information about the American Med Spa Association, please check our description below.